Hi, my name is Lisanne, and I'm a public health nurse here at Public Health Sudbury Districts. If you've been following the news with regards to COVID-19, you've probably heard us mention the term contact tracing. This is a process we use to identify those who have come in contact with somebody who's ill with COVID-19. It is not a new process for us here at the health unit. This is something we do every time a contagious disease is identified in the community. It helps us minimize the spread of infection. We begin by calling the case or the person who is sick with the virus. They help us identify anyone they've spent time with, how long they spent time with them, without keeping their distance, meaning they didn't keep that 2-meter distance that we are asking people to do. We then follow up with the contacts to provide them more information and further direction as to what they should do as a contact. If you do not receive a call, this means that during our process, you have not been identified as a close contact of a case. Contacts are asked to stay home on isolation for 14 days following their last exposure to the person who was sick. During those 14 days, we ask that they stay home and not leave their property unless it's a medical emergency. If this happens, we do ask them to call the healthcare provider in advance to let them know they were named as a close contact to a case of COVID-19. Other things we ask them to do is isolate from other members within the household, meaning they would use their own bathroom and stay in a room on their own if possible. We also ask that they make arrangements for groceries and other supplies to be dropped off to them as opposed to them leaving the house. If this isn't possible, they can call us here at the health unit and we can help them make arrangements. Contacts may receive a daily call or they may get a call on an intermittent basis, depending on if they have symptoms or not. These are wellness checks to make sure they're following the guidelines and remaining well. If you think you were exposed to a case of COVID-19 here in the community or at home, or if you've traveled within or outside of Ontario and you have concerns that you may have been exposed, please give us a call here at the health unit or refer to our website for further information.